I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please. Mayor Holland?
Here.
Vice Mayor Cuff?
Here.
Councilmember Clufus?
Present.
Councilmember Lyon?
Here.
Councilmember Shipley?
Here.
Mayor, all members are present.
Thank you. Okay, we'll now open up to public participation. Any member of the public wish to make public comments on agenda items not on the agenda, please do so at this time. Please state your name for the record, and your 3 minutes will begin.
Setting a precedent. Good morning, Vincent from Woodbury Palm Coast. Read the increase in the homestead exemption on the new ballot. It will pass, as I'm sure you will realize. As a result, the council states that this may require major changes in city and fee structure. You raise three possibilities to recover lost tax dollars: install electric or water utility tax of up to 10%, raise property taxes, increase fees. You cite the decaying stormwater infrastructure, which is in need of major overhaul at considerable expense, and that demand for services keep rising faster than tax revenue. This prompts some basic questions. Did you just notice that the city's stormwater infrastructure is decaying and in need of repair? What are these demands for services, and who is requesting them? The county will also lose tax dollars. Have you or will you meet with the county to discuss possible savings options, for example, tax sharing or consolidation of services? Have you considered a freeze on city employees' salary increases, staff additions, and replacements? Knowing what was coming, why didn't the council cancel expenditures for parasols, the new community centers, solar panels, and playground improvements? Will you institute a comprehensive budget review to ascertain which expenses can be eliminated or appropriated for needed costs? The additional increase in homestead exemption will certainly result in a loss of tax dollars for all Florida cities and counties. Palm Coast will lose $1.8 million in tax dollars if approved. The source is the Flagler County property appraisal. If the city council decides to install an electric or water utility tax, this would produce approximately $350,000 per month or $4.2 million annually. This is based on 50,000 customers at approximately $7 a month, which is a really low-ball estimate. Check your electric bill. This far exceeds the tax dollars of $1.8 million. Our goal should be to recover the lost tax dollars without the need for new electric water utility taxes or increase in the millage rate. Increased fees would appear to be the best choice. Remember, 3 attempts have been made to install electric or water utility taxes, and they have all failed. As a council member, please don't let your legacy be: I voted for a 20-year tax. Thank you.
Take your comments. Next speaker.
Last meeting with the mayor, city manager, and city attorney. If you have them good, if you have, please let us know the results. Please do not set a precedent by giving the developer ways to bypass entries. Thank you.
Thank you for your comments. Next speaker.
Good morning. John Brady, Palm Coast. I hear that the decrease in revenue is going to be $1.8 million. We're going to spend, as reported in the newspaper, in the neighborhood of $1 million to take a 4-lane highway and change it to a 2-lane highway. And we're doing it for safety reasons. Well, then why are we converting an existing 2-lane road to a 4-lane road? If a 2-lane road is safer, why are we making Old Kings Road 4 lanes? So there's $1 million saved right there. Put that away. increase in October for our water, again, a hardship for the poor people. Look at expenses before raising taxes. Thank you.
Thank you for your comments. Next speaker. Seeing no one. The only question that arose about the update on the airport commons. Can you please
I've seen
update?
emails go back and forth as we try to coordinate schedules, but we haven't actually had the meeting. But there are efforts of coordinating schedules at this point.
We will continue to update everyone as we progress. Great. Okay, approval of the minutes. I'm looking for a motion to approve the minutes of the June 5th, 2018 business meeting and the June 12th, 2018 workshop.
So moved.
Moved and seconded. All those in favor, please say aye. Aye. Any opposed? Seeing none, it passes unanimously. A proclamation. Councilmember Lyon will be presenting the proclamation as July as Park and Rec Month. I would ask everyone receiving the proclamation to please come up to the podium. You have to go to the podium.
That's true.
Thank you.
I didn't realize that. I think you might be. There you go.
Thank you. Thank you.
Much.
Morning.
Oh, I got a pickleball racket. If you ever need a fourth or third, yeah, absolutely. Yeah, absolutely. It is. It really is.
Whereas, parks and recreation systems are dedicated to enhancing the quality of our life for millions of residents in communities around the world, recreation programming, leisure activities, and conservation efforts. And whereas parks and recreation activities and leisure experiences provide opportunities for young people to live, grow, and develop into contributing members of society. And whereas parks, recreation activities, and leisure experiences create lifelines and continuous life experiences for older members of the community. And whereas parks, recreation activities, and leisure experiences generate opportunities for people to come together and experience a sense of community. And whereas parks, recreation activities, and leisure experiences pay dividends to communities by attracting businesses, jobs, and increasing house values. And whereas the City of Palm Coast recognizes the vital contributions of employees and volunteers in parks and recreation facilities. And whereas these dedicated supporters keep parks clean and safe for visitors, organize youth activities, provide educational programming on health, nutrition, first aid, and gardening, advocate for more open space and better trails. Now, therefore, be it resolved, the City Council of the City of Palm Coast does hereby proclaim the month of July 2018 as Parks and Recreation Month. Be it further resolved that we hereby request that during Parks and Recreation Month, that all citizens enjoy what their community has to offer by taking part in their favorite sports, visiting the outdoors, and spending time with family and friends, relaxing. Adopted this 19th of June, 2018.
Good morning, Mayor and Council. We just wanted to thank you so much for your support in supporting us as Parks and Recreation. We have another year of great activities and special events planned, and we hope that you will come out and join us. Thank you.
Thank you. Agenda item number 3 is a presentation, Public Health of the Community by the Department of Health, Flagler.
Hi, good morning, Mayor. Good morning, council members. My name is Bob Snyder. I'm the administrator of the Department of Health in Flagler County. And I really do appreciate this once-a-year formal opportunity to give you an update on the Department of Health, especially since 77% of all the clients and patients that we treat come from the city of Palm Coast. This presentation has 3 brief parts. Number 1, just a little reminder of what we do for the community, our staff of 50. Number 2, how healthy is Flagler County? What are we dying from? What is making us sick? And how do we compare to the other 67 counties in the state of Florida when it comes to health? And then thirdly, an update on the 5 health priorities for Flagler County and what our partners in the health department are doing about that and addressing our needs. All right, so thank you again. All right, I don't know about you, but I can't think of anything more important than our health. Does everyone agree with that? You know, and that basically is, you know, the mission of the health department in all 67 counties, and that is to improve the health of all the people in Florida, especially here in Flagler County. Good health means a very healthy life. And all right there, Jason, what am I doing wrong there, Chief? I'm not sure if, let's see. Here we go. I'm sorry, got it. Okay, I mentioned that we're a staff of 50. Dr. Stephen Bickle is our medical director. Carmen Frawley is our ARNP and nurse midwife. And Bonnie Welters, our Director of Nurses, and Dr. Francis Bay is our primary dentist. But we also have part-time dentists and physicians, dental hygienists, wonderful team of nurses, business clerks, as I said, a group of 50. And we are growing. We did have 2 layoffs about 4 years ago, but we've been able to find additional revenue for the services that we provide, so we're on a bit of a growth mode at the moment. In 2017, we touched the lives of 15,671 people in Flagler County. Again, 70% of them reside in the city of Palm Coast. We provided 182,000 different services, and I'm going to just mention a few of them next. Very broad scope of services affecting infants and seniors. And here's some of them. 10,000 immunizations last year, you know, flu vaccines, back to school rush to get kids immunized before going back to school, prenatal care, family planning, the WIC program, which I know you've heard of. Our dental program is probably one of the largest. We take care of all the dental needs of Medicaid children in our community, about 5,000 altogether. We also manage all the school health services, so all the nurses and all the staff members and all of our schools are managed by Stephanie Ears, our RN, our school health nurse. Probably one of the most important things we do is track, investigate, and monitor reportable diseases. So if there's a GI outbreak in a child care center, or measles or mumps, or remember the Zika virus 2 years ago, rabies, all these kinds of issues are ones that our epidemiology RN and staff follow through on immediately. Sexually transmitted disease, I am sad to report that throughout the state of Florida, gonorrhea and chlamydia especially are up significantly, also in Flagler County. We have about 7 to 8 walk-ins a day of men or women worried about having STD and wanting to be treated immediately. And then we have a disease investigation nurse who even goes beyond treating that individual person to try to find out who the partners are so that we can stop this from spreading. Our HIV program, about 2 years ago, the Volusia County Health Department took care of all the HIV patients in Flagler County. Well, we started doing that on our own. Dr. Stephen Bickle is our HIV clinical director, and right now we're treating about 80 individuals with HIV in our community. And we've gotten their their antiviral loads down to imperceptible, undetectable levels. So we're doing very well with that program. We manage the vital stats in the community, and I'll talk about the other 3 items in just a moment. Partnerships are critical. Through Flagler Cares, which I hope as time goes on, we get to know more about Flagler Cares, that is the City of Palm Coast. It's a very important group because all these partners of the health department are all represented under Flagler Cares. About 40 to 50 organizations in the community, all the municipalities, the school system, sheriff's department, law enforcement, Stuart Marchman, Early Learning Coalition, all of us work together throughout the year to address the 5 health priorities that I'll show you in just a moment. One of our biggest partners is the school system. We have about 4 distinct programs that we are doing with them. We partnered during the special needs shelter, during disasters. We're going to be starting flu vaccines this school year. They were using a private company, but the vaccine penetration rate has plummeted over the years. So we're going to do our best to re-raise that vaccination rate. Tommy Tant said, hey, fantastic, because we only get paid when kids are in school, so please help us keep our children healthy. The dental sealant program we began 2 years ago, we have sealed the teeth of about 800 kids to prevent dental caries and dental disease. And then, of course, running all the school health nursing activities throughout all of our schools. Wonderful partnership with the school system and the county and the National Guard. We all remember Irma and Matthew. Well, it was the health department and our staff and volunteers that managed and coordinated the care of 312 people, really strangers to us, but people who are chronically ill, dialysis patients, people dependent upon oxygen and other medical devices to live. We had a lot of dementia patients during Irma, more so than during Matthew. So we took care of these folks 24/7, the most vulnerable in our community, for about almost a week during Irma and Matthew. Another example of our partnership with the school system is every single child in 3 different grades require vision, hearing, scoliosis, growth and development screening. And for many years in a row now, we've been able to get over 100% of our kids screened for these things. When kids move from one school to another, they get screened twice. So that's why it's over 100%. All right, second part of the presentation is how healthy is Flagler County? And just a comment before I share some data with you, it truly does matter where you live, where you work, where you play, as to how healthy you are. What kind of health behaviors do we engage in? What's our socioeconomic status? What are those social determinants of health that basically predict what our health outcomes will be? You'll see clearly what I mean. Back in 2014, Flagler County, out of 67 counties, we were the 22nd healthiest community in the state. And I'm happy to report that we are now number 14. We're the 14th healthiest community in the state of Florida out of 67 counties. Here's a breakdown of us and our neighbors. When it comes to health outcomes, we're 14th. When it comes to length of life, we're 28th. And quality of life, we're 6th. Look at Putnam County, ranked 66th. St. John's, number 1. Volusia County, 44. Remember I mentioned social determinants of health? So you may want to think about, think about St. John's for just a minute. Who do we think has the highest median household income in the state of Florida? Who has the greatest number of individuals with health insurance, either Medicare, Medicaid, or private? Who has the highest educational attainment in the state of Florida? It's St. Johns County. So you can see the connection with these things. So mortality of life in Flagler County, males live on average 6 years longer than women. Fellas, we got to find out why. Why is that happening? That's quite a gap. but we kind of match the average length of life, male and female, in the state of Florida. Females live an average of 82 years. Quality of life, where it says they're poor or fair health, I'll tell you what that's about. That is the result of a national survey. But by the way, these health outcome rankings are done for every single county in the United States. It's done by the University of Wisconsin and the Robert Wood Johnson Foundation every single year. So they look at all these things to determine that ranking of 14th for us. But to that question, poor for health, the simple question is, have you felt that you have been in a situation of poor or fair health in the last month? Well, 14% of Flagler County residents said yes to that question. So, but it is in green. Also, the answer to the question about mental health days, because we are better off than the state average. That's why it's bracketed in green. Causes of death, nationwide, heart disease is the #1 cause of death. In Flagler County, it's cancer, followed by heart disease, stroke, and respiratory disease. I think we've all read a little bit about the high rate of suicide in our country. Same holds for the state of Florida. In Flagler County, we had 20 suicides in 2016, and the same number in 2017. Health behaviors contribute to that ranking of being 14th. How many of us smoke? 15% of us do. 63% of us are overweight or obese. I won't go through all of these, but these are all the kinds of data points that the University of Wisconsin and the Robert Wood Foundation take into account. Clinical care, 16% of us are uninsured. A big determinant and indicator for access and how healthy we are is access to care. We are doing better on the number of primary care physicians and dentists and mental health providers over the years, but you can see that number is in red, and so we're still behind the state average. But we believe that the Florida Hospital and Halifax are doing such a tremendous job in acquiring more doctors and providers for our community. A real sad statistic is alcohol-impaired driving deaths. So all automobile deaths, 40% of those deaths are related to drinking while driving. And we are above the state average on that data point. Socioeconomic factors. Thank goodness our unemployment rate is again low and less than 4% now. Because if you have a job, greater chance of having health insurance coverage. So I just wanted to share some of that stuff with you. Just some other health outcomes. We'll not go through all of these, but there is one I'd love to point out, and that is infant mortality. If you recall, we do not have a birthing hospital here in Flagler County. The two largest OBGYN groups are in Ormond Beach and Daytona. That's where our birthing hospitals are, as well as Flagler Hospital in St. Augustine. So last year we had 810 births in Flagler County. 53% of those births were moms covered by Medicaid. And so thank goodness for our prenatal program, because they see for the first 8 months of pregnancy Carmel Frawley, our very capable ARNP and nurse midwife. I'm afraid that infant mortality would increase significantly if we didn't provide this service. So we hand off obviously to the two larger groups when it's time for delivery. But infant mortality in the state of Florida is 6.1 deaths. That's within the first year of life per 1,000 live births. In Flagler County, it's 2.5. For African American babies, it is 0, 2 years in a row. That is absolutely remarkable. Hispanic babies born of Hispanic descent, unfortunately 11.5. Much greater than the state average of 5.4, and we do have a program that we initiated to address that. Third part of the presentation and last part has to do with partnerships again, and Flagler Cares. Every 3 years, every hospital and every health department in the country need to conduct a community health assessment and community health improvement plan. That involves a large community survey, a gathering of 50-plus organizations, the Flagler Care Coalition members, and we poured over 300 data points and used that to establish priorities for the next 3 years. Just as a reminder, those priorities were adult mental health, youth behavioral health, cardiovascular disease and diabetes, the health of mothers and children under age 5, and domestic violence, which has skyrocketed in Flagler County since 2013. This spiked this way, trended very up. So what are we doing about addressing these priorities? Well, I'll just give a couple of examples. Okay, for adult mental health, you saw that suicide rate. Well, Kathleen Conklin and Carrie Baird and Lynette Schott got together to form a suicide prevention task force. I think they presented to the council to raise the awareness of suicide in our community. Since then, a website has been created to, again, what do we do about this? Raising awareness, but then if we see someone with signs, what do we do? Thus the importance of the website. Youth behavioral health, Flagler Cares with the school system and Stuart Marchman, they organized an effort to apply for a grant that has resulted in more mental health providers in our school system. It's, I have there, it's a $300,000 implementation grant. It's been raised to $400,000. So we have extra personnel at Halifax Health for their intake and inpatient behavioral health unit for children, and then more providers in our schools. Diabetes, the health department has taken the lead on that with partnership from Florida Hospital Flagler and Healthcare Partners, which is their employed physician group. No one is doing a diabetes self-management education in our community, taking newly diagnosed diabetics and walking them through the diagnosis, the disease, what are the comorbidities, how do you manage your insulin and your medication. That is what we plan on doing, hiring a little army of nurses to do that for especially the 17 primary care physicians to start who work for Florida Hospital Flagler. Mothers and children under age 5, the Early Learning Coalition, and a new program we started called LifeSong, and an existing program, WIC, are addressing different aspects of this. LifeSong is a program that is geared towards the faith-based community, especially African American churches, to do a lot of teaching and education about co-sleeping. I serve on the Northeast Child Death Care Review Committee, and it's just amazing the number of cases we have annually of children dying by co-sleeping with their parents. So much more education has to occur to stop that activity and behavior. And that's what LifeSong is all about. Domestic violence, Sheriff Staley took the lead on that, and he initiated a summit back in January. And so we're following and monitoring the recommendations for him and his staff, as well as juvenile justice and Stuart Marchman when it comes to that. Long-term initiatives, we plan on expanding our dental program. The county commissioners have agreed to provide the dollars necessary to double the size of our program. Instead of 3 operatories, we're going to have 6. Construction should begin any day now. We're going to be expanding the dental sealant program in our elementary schools, our HIV program. We're getting into a service called PrEP. That's for the HIV patients that do participate in potentially bad behaviors. And so it's medication that we can give them prophylaxically to avoid them getting HIV. And hepatitis C is another one. I mentioned the diabetes program. And I'll mention the fact, too, that, you know, we're one of the largest growing communities in the state of Florida, and sometimes that can bite us because sometimes how money is allocated from Tallahassee when it comes to education and health care, sometimes we don't get our fair share because it's based on methodologies and formulas that are many, many years old. So that is something that I plan on fighting vigorously over the next few years, is try to get more revenue from the state general coffers for our health department. Well, thank you so much for your time. I do appreciate it. And It's good seeing everyone.
Council, any questions?
I'm sorry.
Go ahead. No, I think it's important, we just recognized July as Parks and Rec Month, and I think it really demonstrates our role in this health and wellness initiative, oftentimes partnering with different institutions that promote health and wellness. As far as the Early Learning Coalition, they do a lot of eye and hearing testing, and I've spoken to them historically, and they said there's a true benefit for going in at a young age to go through that with children. It helps them in learning practices, application practices. I was just curious, do you offer any diabetes screening for that age group, or who does that?
Yeah, really, maybe a pediatric office would do that, of course, but that's part of the problem is we don't have, that's why we want to get into the diabetes monitoring business, Mayor. No one is really doing that comprehensively. There's three parts to this. It's, the training and the self-management education, by an RN, someone who's credentialed to hold the hands of the newly diabetics. Medical nutritional therapy, and then preventative services to avoid someone from becoming a diabetic. I told my primary care doctor about this, and he said 60% of my patients are in that category of pre-diabetes. That's where the effort needs to be. So we need to focus on prevention for adults and children. So I can envision us, as we get started, having a program specifically for children.
I also think, when you're looking at the rates and the data points, obesity, I'm certain, contributes to the pre-diabetic notion, not in all cases. My 93-year-old grandfather developed diabetes at 87 years old, and he was very sad when I take away his candy, but but it is a really serious issue, and I'm always interested in the data and the outcomes and how we track and measure those. So if there's a way also to partner with the Early Learning Coalition in that realm, I think that might be very helpful, since they're in there and the providers and working collaboratively, maybe even an educational program within their training that they do for the child care providers might be helpful.
That's a wonderful recommendation, suggestion. I agree. Thank you for that.
I did have one question about the infant mortality rates. How they're calculated. You said that it's deaths within the first 2 years after
the first year of life, the first 365 days.
The first year, okay. But has that affected by the fact that most live births occur outside the county? People go outside the county for the birth and then come back in here. That first year is lived here, but the birth is elsewhere. Is that counted in our births or in that county's birth?
Yeah, we do have quite a few births outside the county. All of them, because we don't have a birthing hospital. But no, it takes into account anyone with a Flagler County address. So it takes 810 babies were born last year.
Thank you.
You're welcome.
Absolutely. I am a huge fan of all the different components that you work on and that all the teammates work on. I'm a huge fan. I'm kind of echoing what our mayor said. The Diabetes Self-Management Education Program, I think, is a tremendous opportunity to really help individuals. I've seen it impact people in my family who are pre-diabetic, and a lot of it has to do with a little bit of denial, but a little bit of the unknown and not being sure how to change the 60 years of lifestyle events, that got you to where you are. And just that little bit of education could really change lives and save lives. So thank you.
Oh, you're welcome. Our plan is to hire a coordinator by September 1st. Again, we're in close partnership with the hospital, because that's where we're going to get the referrals from the 17 Florida hospital, Florida employed physicians. So we started there. So we'll have a coordinator, probably a second RN, a life coach, and a registered dietitian as the team to try to change behaviors. If we can just do two things: stop smoking and consuming all the sugar that we do as people, that will really impact for better health.
And as far as the graduation rate, I'm just curious, how do they, I know St. Johns County is rated the top school district in the state of Florida. I really appreciate the fact that we're continuing to climb, and it should be a goal of ours as a community to continue to develop strategies to increase our wellness and our health across the board. But the graduation rates, how do they define graduation rates? I'm curious.
Yeah, that 77%, so doesn't mean that only 77% of our high schoolers graduate from high school. That's the attainment, educational attainment of all the residents in Flagler County. So all people have come from different parts of the country and different areas. It's all of us collectively, that our high school graduation rate collectively is 77%.
So it's all of our residents as a whole and looking at the
Yes.
graduation rates of everyone?
Yes, yes, yep, 77%, yep.
Okay, that's interesting. Okay, any other questions or comments? Any member from the public wish to make public comment on agenda item number 3, please do so at this time.
Good morning, Councilman.
Morning.
Morning, Mayor. Before anything else, Mr. Rob Schneider, very, very elucidating. Very, very, very beautiful. I have only one question.
Yes, sir.
Due to the fact that my background is a police officer, a retired police officer, there's one issue that I take very seriously, which is domestic violence.
Yes.
In order to help the people that's involved with this, I want to ask you one question.
Yes.
Is there an age bracket that's actually most accentuated in your, because that could help the sheriff?
Yeah. There really is not a specific age bracket. It is happening, just couples that are in their early 20s all the way through senior age. What is a common link, though, with the domestic violence is what you might suspect. The adult behavioral health issues, that is number one priority, and that involves alcohol abuse, substance abuse, and mental health issues. All those things are correlated and commingled when it comes to contributing to domestic violence, and of course, anger management.
Very beautiful, very well done. And if you need any help that I could help with, don't hesitate.
All right, sir, thank you.
Thank you. Thank you for your presentation, and I appreciate everything you do in the community.
Thank you for
Thank
the
you.
opportunity. Thanks.
Okay, council members, any member of the public wish to make public comment on agenda item number 4, 5, 6, 7, 8? This is the consent agenda. Please do so at this time. I want to close public comments. I'll take it to this council. I'll entertain a motion to approve the consent agenda.
Move the consent agenda for approval.
Second.
Moved and seconded. All those in favor, please say aye. Aye.
Aye.
Any opposed? Seeing none, it passes unanimously. Okay, we'll now move to public participation. Any member of the public wish to make public comment on agenda items or non-agenda items, please do so at this time.
Good morning, George Mayo, Palm Coast. Excuse me. Last night I saw a documentary talking about recycling, how they talked to different major recyclers in different states, how the primary acceptor of all, both paper, glass, and plastic recycling is China, and they have drastically cut down on the recycling they are taking from the United States for different reasons, and now also including the tariffs that have been set up, so it's become a war. Vietnam, Mexico, and there was another country where the other countries that were accepting recycling, and they have drastically cut down. These major recyclers were saying that what they were getting paid for now, they now have to pay to take away. I'm wondering where our contract is with Waste Management. I don't know if we're getting paid or we're paying them to take our recycling at a reduced rate. This may be something we have to figure into, because if there is no longer or a smaller market for the recycling, that will definitely affect the contract with Waste Management, which will affect, of course, the bills for each and every citizen on what it's going to cost to have that taken away. The other thing I'm curious about is I read that the school property that was demolished over there on Palm Coast Parkway over by the fire department, Commerce Drive or whatever it might have been, the school that was knocked down. is up for sale, mentioned that the city might be interested in looking to buy it. I'm just curious if that is something we are looking into, and if it is, what might the use be? Thank you.
Thank you for your comments. Next speaker. Seeing none, I'll close public comment. Waste Pro, not Waste Management, different vendor. But can you please talk about our recycling program, how we instituted, and any discussions on
Sure.
perhaps new policies that may impact that?
Well, first of all, Waste Pro does pay us a flat amount every month. So what the market bears has no bearing on the city. That was a change we did with our recent contract, because what we were seeing is fluctuation going up and down. And so we made it so it was just flat. That also gives Waste Pro the incentive to encourage recycling, because before we were getting the revenue, they were collecting it, so they had the expense and we were getting the benefit. At this point, they now get the benefit of selling it, so it actually encourages them or helps them encourage people to recycle. And as far as, the best thing to do is just, all of us keep in mind recycling. Our Arbor Day, that was a main focus. We've been doing all sorts of programs to encourage people to recycle through our green team. And, financially it doesn't have an impact on us, but it's just the right thing to do. I didn't write the next comments. The other comment was, we have shown no interest in purchasing that.
I think it was actually the developer that developed Island Walk has an interest in purchasing that. So it's not the city that has ever discussed purchasing that.
No, we have, we know that there's development potential there. I think very important development potential, because you have Kohl's, and it would really create more of a shopping center. And then that would also help St. Joe's Plaza, because the more people you can get to go west of Belterre, the more that would help that whole St. Joe's Plaza and those businesses. So I've had conversations with the superintendent. Obviously, it's the school board's decision, but we know there are development interest, shopping center kind of development for that property, and we think that would be a great idea. We have not shown any interest as a city of purchasing it because it's good commercial property.
Okay, discussion by city council of matters not on the agenda. Councilmember Shipley. Councilmember Clufus.
I just wanted to say congrats on how everything went with the Portugal Day events. I was traveling, but everybody said it was phenomenal, so onward and upward, and it's good to be back.
I wanted to talk about this Cooper situation again. I'm still getting inundated with the emails for that, and I've looked into it more carefully. And I understand the restraint of the law. As I read the statute, the owner of the dog gets it, well, let's see. We'll skip the first part. The dog was declared dangerous, and that's not, once that's happened, it puts you in a different section of the statute. And the section of a dog already dangerous, it's slightly different in that there's no restrictions on it. It is simply if the dog caused a severe injury then was not provoked, then the dog is destroyed. But it does allow them to appeal either the determination or the punishment. And there's a gray room there. So if I were their attorney, I would be trying to argue in the appeal that the punishment is overly harsh and not violative of the Constitution. But I'm not their attorney. I'm not practicing that. I'd throw every argument I could out there if I was trying to say, if I was in their position. And I know we all like animals. I certainly do. And the question then is, well, what is the status? It's in the case right now. It's in the court, and it's going to be determined by the judge. And what flexibility the judge has, the city doesn't have any say on what the judge will do. But what the city does have is we are still a party to that suit. The owners filed a petition for cert with the court. The court has not entered an order to demand, to show cause that would require a responsive pleading. If they do so, I would like that the city not respond, not file a plan, a defense to uphold this. In other words, just take no position. Allow the owners of the dog to take their stand and take their chances with the court, and not take an adversarial position against them. If the court says that we need a responsive pleading, we don't have to do that. And that was what I think our proper approach for the city to do at this point is.
That all?
That's all.
Okay, thank you.
I have nothing for this meeting.
Okay. I just had one item. A friend of mine is the head of the construction project over at Matanzas High School. And he teaches students electrical, plumbing, construction practices. They did a pad site behind Matanzas, and he and I were talking recently, and they don't really have a warehouse where they can actually teach practical construction practices to help these students that may not want to go to college but may want to learn a trade. And I think there's an opportunity, now it's within the school district to do this, but I'd like to foster this conversation or facilitate a way to see if there's a way to partner with Habitat for Humanity, where these students can have real practical experience and volunteer time, but get credits of actually building houses in our community for people in need. I know our Vice Mayor Cuff serves on Habitat for Humanity, but I was talking to Lindsay Elliott about it as well, and there's a real interest there. We are talking about a significant labor shortage in our community. The projects that we approve always come in higher than what is anticipated, and we oftentimes are struggling to find the skill set, because most of the individuals, when the downturn of the economy occurred, left our community to find work elsewhere. Most of them are probably working in Orlando on major roadway projects as well, but if we can support supporting students that want to learn a trade that can then offer a critical service in our community, I think that's beneficial as a whole. And so I'd like for us as a council to see how we can maybe support that initiative or relationship. And I don't know if you want to comment, Vice Mayor Cuff, but I thought it would be a really neat relationship and a partnership, but it would also help us greatly as a community offer that support in again, helping train real life practical experiences for these students. Instead of just saying, okay, we're going to build a pad site behind Matanzas because that's something that was needed, and then they learned how to do that. To learn how to build an entire house from the ground up, I think would offer that, and they build several homes a year. I don't know what they're doing.
Between 4 and 5 has been our average for the last several years.
So Lindsay showed an interest, and I thought, again, it's through the school district, but it might be a way for us to participate in the conversation.
I think it would be a good idea. One of the problems, which I assume we can overcome if it's with the school district, is that Habitat's guidelines for volunteers generally limit what anyone under 16, I believe it is, can do on a job site to prevent you from nailing your hand to the wall. I know there was a small program, and I don't know what the status of it is, with one of the schools in Putnam County. They were approached by one of the teachers and did a little with them. I think the main, depending on the volume, the number of students that would be interested, there's certainly opportunity there, and I'd be happy to assist however we can. I am technically not on the board of directors for Habitat as of July 1st. I've been termed out now for like the 11th time, but I'll still be working with them for the coming year until they can put me back on a year from now. So, I'd be happy to talk to Lindsay about that and see if there's something we can do.
And Jim, if you could talk to the superintendent about that idea, I think that'd be beneficial.
Next time we get together, I'll add it to the list, yes.
Thank you. That's all I have. Discussion by city attorney of matters not on the agenda. I'm going to ask you to comment on Councilmember Lyons' comments about where we are in the process and certainly our participation.
Fair enough. Yes, just a little bit of background so that everyone can have the context. As has been mentioned and as we discussed at the last City Council workshop, this is a case that arose out of another jurisdiction, and that other jurisdiction found that this particular animal was indeed a dangerous dog. That was a final decision. Councilman, I know you're aware of all this, but I'm just trying to make sure that everyone that's listening is aware of this. And the dog was then relocated up to a relative's home here in Flagler County in Palm Coast. And by the way, that decision in that other jurisdiction was not appealed. It was a final decision. The dog was declared dangerous. Once the dog was relocated up here, it had another attack and another bite. There is no dispute that bite resulted in a serious injury as is defined in the state statute. It's not contested. And as required, there was an investigation done by the city staff, and an investigation led to initial determination. That's the term that's used in the state statute in our code, that this bite was also unprovoked, and therefore the dog was found to, again, meet the state requirements for being declared a dangerous dog. Again, all right, the state statute, now we're getting to your points, Councilmember, and that is the state statute that's involved is 767.13 subsection 2, which is very clear, and I'm going to read the pertinent sections, and I know all of you are aware of this, but I just again want to make this part of the record. It basically says, and I'm reading the parts that are relevant to this discussion we're having today, that says, if a dog that has been previously declared dangerous, which it has, attacks and causes severe injury, which it did, to any human, that was the nature, it wasn't to another animal, it was to a human, the dog shall be immediately confiscated by an animal control authority, which the city of Palm Coast did, placed in quarantine, which it did, and for the proper length of time, held for 10 business days after the owner is given written notification, which was given, and thereafter destroyed in an expeditious and humane manner. So it says shall, and there's no discretion by the animal control authority. There's no discretion under the state statute by the hearing officer or the special magistrate in this case, which of course rendered a decision because the animal owner, the dog owner in this case, did appeal the initial determination made by the city staff. The hearing officer upheld that decision, in fact entered an order specifically making all the findings, and I'm not making this up, this was the findings of the initial determination, of course, and supported by the testimony at the adversarial quasi-judicial hearing that the hearing officer held. That decision is now being appealed, as you've indicated. And the city in this case is a party. It is a respondent to the appeal, and the city is in a position of conforming to the statute and supporting the decision that was rendered in its favor by the hearing officer. This council does not have a specific role during any of the process as far as I've stated before, does not have a role procedurally under state law or under our code in any of the process that I just described. And it's my recommendation as a matter of law to support, to be consistent with your city code and state law, that and to provide support for the hearing officer in this case, that we proceed as is contemplated under the rules of appellate procedure and respond accordingly in support of the decision of the hearing officer.
And let me also comment, because I do think it needs to be stated. I mean, Barbara Grossman probably has one of the toughest jobs, our code enforcement director in the entire city. She deals with a myriad of issues on any given day, but animal issues certainly are a constant. Her team is a compassionate team of people that do everything in their power to protect animals in their households. So for anyone to suggest, or any entity to suggest that our city department does not really take a look at this and try to find what's in the best interest of not only animals, but also ensuring the safety of our residents that are doing their job when they enter a home is equally as important. So I just wanted to state that because there's a lot of information floating around there, and they have details and details and details and reports and records, and do apply the law, the state law that dictates some of these outcomes. So, this is a very sad issue, and it's very unfortunate. I think we're all anticipating and waiting to see what the outcome will be from the judge who's hearing this case, in the upcoming weeks. So, I certainly share your thoughts on, us not taking a vocal stance, and I don't think anyone on this council has. We have made it very clear that we are following the law as stated, and it's going through a legal process now, and we're trying to anticipate the outcomes like everyone else.
I don't disagree with any of the background there that our council gave, and I don't disagree with the hearing officer's findings. Under the circumstances, I think that she was, probably that, I didn't hear the evidence, so I don't want to opine. I have no reason to disagree with her at that. It appears to have gone through a proper due process. It appears to have done everything the way we're supposed to do it, and the law is what it is. But at this stage, and having read their appeal, they have an uphill battle. And I'm just saying, I don't think the city needs to be pushing them back down. If they want to go and challenge the way the law is applied, then let them have that to the court, to the judge. Don't have the city be submitting briefs arguing that, no, this is right. I mean, that's my position. Certainly as a political position, I understand that the goal of the statute and the purpose of our enforcing it is public safety. And I don't want to take away from that at all. But if they think that they can convince a court that this is, that this was an unjust law, or that it was improperly done, I'm just saying we don't need to file a brief. There are many times, we see it all the time in a federal level, where an administration changes and says the Department of Justice is no longer going to continue the argument that the previous administration made. We'll just simply not file briefs on those cases. And I think we as a city can do the same thing, and not file a brief in response.
May I interject? A couple of things. I'm good with us not filing or arguing whether the dog is dangerous or not dangerous. The only thing that is important to us as administration and staff, and should be the whole city, is if they are arguing we did not do something properly, but we believe we did, then I think we have an obligation to make the case that we took proper steps. I don't want to be found that we, just by default, that we didn't take proper steps in the case and have to start all over again. So if we can, at least make the arguments of, if we believe we took proper steps, and show why we believe we took proper steps, I think our attorneys need to do that. If it is as far as is the dog dangerous, or what the outcome of the determination, I'm very good about us staying out of that and leaving that up to the judge. Can we kind of reach that as a good place to be?
And let me add, if the petition, as you're aware, council member, attacks the statute,
yes,
which is the current state law, but also attacks procedurally the actions of the city and the actions of hearing officer procedurally. And I believe that as your city manager just indicated, the city feels very strongly that it did exactly, and very, very careful to make sure it dotted its I's and crossed its T's in a case that where the facts are as complicated and as emotional as these, where you have a victim and you have an animal and you have an animal's owner. I mean, this is a tough case emotionally, and and legally. And we believe it's important that we be allowed, apart from this particular case, but the precedent in this case, we'd be allowed to make sure that the court, when it issues the order to show cause, if it issues the order to show cause, the court understands that the city does have a position as far as procedurally that the city did it right. And,
But that's the only argument that we need to be making is procedurally that we didn't do anything wrong.
I think I can agree to that, having, without trying to get into too much detail about their brief and what their specific arguments. Any argument that said that we didn't provide proper notice, anything like that, I absolutely think that we did. And I don't have a problem with claiming, responding and saying that we did. As to the attack of the value of the statute and any other defenses they put based on what the state legislature in Tallahassee has decided, I don't want to take a position on that.
I was very tempted during council comment to weigh in, but I didn't want to. As I've read the statute in some detail and I've tried to acquaint myself with the facts of the case, my biggest concern with the idea that the city council would simply direct the city attorney to throw in the towel, if you will, either on the appeal to the circuit court or upon remand to a hearing officer, if that's the decision the circuit judge ultimately makes, is that the statute at this point is binary. Either the dog lives because it's deemed to be not dangerous, or the statute is declared unconstitutional or whatever, or the dog has to be destroyed in accordance with the current statute. I don't like that. I hate that. I've held 4 dogs in my arms as they were destroyed, and I don't want to ever see anybody have to do that. But there is nothing in the law, the way it is written, that gives either the circuit court or the hearing officer, if it's remanded to a hearing officer, the authority to order what the advocates for Cooper are telling me they want to see, which is to be sent to this rescue place. I'd love to see that happen, but I, as a city council member, am not comfortable directing city staff to take any action that would legally allow this dog to be deemed not dangerous and therefore left in the community, unless the dog can be placed somewhere where it will not bite another person, where it can be properly cared for. I'm not comfortable with if the court decides it, if the hearing officer decides it, that's fine, but my legal opinion, and I try to avoid giving that, is neither the court nor the hearing officer have the authority to render a decision that says he's dangerous, but he has to go to this rescue organization rather than being destroyed. And the alternative of him being deemed not to be dangerous when he's already bitten 2 people and basically, as far as I can tell, been shipped out of Port Orange so that he's now a Palm Coast problem, is the danger to the community. And I hate to think that way because I love dogs. I've rescued plenty of dogs in my life. But I think we have to let the process follow the process. I notice nobody that's advocating for Cooper is suggesting that the Humane Society ignore the law and transport him over to the rescue, and I'm sure the officials at the Humane Society, the board and the staff, would refuse to do that if that's been demanded of them. I doubt the circuit court judge who is going to hear this, and I am aware of Judge Perkins' reputation, and I have a lot of respect for him, is entertaining ex parte communications from the advocates for Cooper that will influence his decision. I think we have to let the appeal go the way it is. If one of the arguments is the statute is unconstitutional, I don't see any reason why the city should spend thousands of dollars researching precedent and arguing that it is. But I am not comfortable directing our staff to just go in the tank on this in hopes that Cooper will be declared not dangerous and therefore allowed to live, because clearly he is dangerous. And I know it's most likely a people problem, not a dog problem. If he's properly cared for, properly confined, I don't want to see him die. I want to see him live. But given the oath that I took when I became a city council member to uphold the laws, I am not comfortable doing anything to create a situation where this dog is going to be back in society where this can happen a third time, and then have that come back on the city. I'd love to see him go to the rescue organization. I'd love to see him live. But the only remedy that I can see that will achieve that is if the state legislature adds that option as an alternative to declaring that a dog that's been deemed dangerous a second time can be placed in one of these organizations rather than destroyed. So that's my position on any further action by this council, barring some argument that I haven't heard. And like everybody else on the council, I've heard a lot of arguments over the last several weeks.
Council members, if I could add just one comment, I wanted to follow up on that. Councilmember Cupp, I would strongly agree with especially that part that you indicate that throughout this process, the one consistent position that has been taken by those folks that are advocating for the non-destruction, for lack of a better term, of Cooper, is that it be allowed, that someone allow it to go to this facility over on the west coast of Florida. And as Councilmember Cuff, you indicated, that's just not an option that's legally available. It wasn't available to the code enforcement animal control staff, and it was not legally available under the statute and under code to the hearing officer, the special magistrate, and it's not legally available to the city of Palm Coast. And so what is being asked for here is just not legally available. It's not something that we can do. And of course, if we were to violate state law and do that, and then there was another incident, well, I don't need to tell you what could happen from that. That's fairly self-evident.
Mr. Lyon, one of the things that may be a possibility if City Council would like is talk to our state legislatures and see if we can't get this law changed to allow dogs go to a rescue. Some facility that knows how to deal with this, that they're not running around in a community biting a third time. But that might be a different approach, is a legislative approach to try to change the state law. So we have this option in the future. That may not help Cooper, but
it'll help a lot of other dogs, though, that are in the same boat, that might give them another option.
Right. So that's another possibility. City Council could take that position.
I just want to make a response to Councilman Cuff, and I'm nothing if not pedantic. There's no question of, in this particular circumstance, the set of facts, there's no question that Cooper would be determined not dangerous. That's a decision that's been made and is final. The second tier is, now that you have a dangerous dog that bit someone, is putting the dog down the only solution? Because if the court decides, the law that says a judge has no discretion here, and the penalty by this law is destruction of the animal with no judicial freedom, then, if the court determines that, then, or determines that the law is not good because of that, or any other reason that determines the law is not good, then, you're left in a sort of a gray area as what are the options available, but it leaves it to the judge's discretion. And even if they come back and say the findings were wrong or the service was not proper or whatever, the dog is still dangerous. And all of those restrictions under the first statute section still apply. The dogs still have to be restrained, muzzled, fenced in, all of those things that are required under the first part of the statute. So it's not a question of putting the dog back, at loose in the community. It's just a question of when they're challenging the statute as, and they've, not too many lawyers at the table already, but as getting, as violating the process required in any takings action, which is what they've argued in their brief, that is, the state is taking somebody's property, and there are certain safeguards they need to do before they take someone's property. And they're arguing the statute doesn't provide those safeguards. And I'm fine with saying, hey, we did everything the statute requires of us, and our hearing officer did everything that that was required of her. But I would just, and this will be my last word on it, I would like the city not to take a position on whether or not the statute violates the state or federal constitution.
The only thing I would add to that, and this is just factual information, I do not want to be perceived as being an advocate one way or the other. My job is to try to remain neutral and also to provide you with legal guidance. And this section, 767.13 subsection 1-2, was in 2015 a prior version of this statute, was indeed by a circuit court over on the West Coast, the Southeast Coast, Riviera Beach, was held unconstitutional. And for just unbridled discretion that circuit court judge held, and for other factors, procedural issues, as far as not allowing a dog owner to be able to make these procedural arguments or these defenses. That statute has been amended. The legislature came in and amended that statute after that decision. So again, I'm just sharing that with you, not to say that the new version of the statute may be found by this circuit judge here in Flagler counties as having problems. But I did want you to know that that argument has been made, and it was successful 3 years ago, but the statute's been changed to address those deficiencies that circuit court 3 years ago found. I think it's important for the record to be clear that what we're dealing with now is something that has already faced that and has been arguably corrected to deal with those issues.
But to summarize, we have no intention of arguing whether the state law is constitutional or not, or argue the case on the state law. I think that's everybody's saying the same thing, is that we're not going to spend money and time on the arguments of the state law. The only thing we're going to spend time is saying that we did things correctly, as procedurally, if we're put in that position of having to do that. So I think we're all saying the same thing.
Nobody on this council has indicated that we're going to go challenge this, so I don't know where this is coming from. It's rather frustrating when information is put out there that's not accurate.
Right.
And we're continually having to defend ourselves on this position. This council has not taken any action to defend the constitutionality of this ruling by state statute. So I just want to make that abundantly clear, because there are posters and flyers being put into businesses that are coming after the city of Palm Coast, stating that we are not advocating for this animal. And to Vice Mayor Cuff's point, there is also a human component when a resident in our community got severely injured, that we need to balance this discussion. We are all animal advocates, every single one of us on this council. But it gets very frustrating when one side is out there stating information that's not accurate. So I would ask each of us to set the record straight when we're approached by different organizations and groups in this community that are stipulating something opposite of what actually has occurred.
And I apologize, but I have to receive direction. And if my office receives an order to show cause, Mayor, to respond to the allegations in the petition, we will do so. We will do so fully, to the full extent, for advocacy for our client. And to the extent that requires us to make an argument against all of the points that are made in the petition, that may include supporting the state statute and arguing that it is not unconstitutional. So I am sorry, but I need direction. And without further direction on any specific point, we will do what we are paid to do. And that is defend the decision of the special magistrate, and that's procedurally and substantively. And I'm sorry to have to do this to all of you, but I mean, that's my job. My job is to defend that decision, and we will do so.
I think we have stated in our discussions that we must defend our decision from a procedural standpoint, and that's what we will do.
And I would remind this council that it's not just, again, I'm not trying to be an advocate, but I'm telling you what the law is. It's not just the state statute that we'll be defending here. It's also our city code. Our city code has the same exact language as the state statute that is being challenged in this petition. So if you direct me not to defend the state statute, then I'm not defending city code as well.
And I don't want to, we've already probably over-talked this and overthought it, but Mr. Reichman, on the point of the city code, it's my understanding from reading the state statute that our code cannot be more lenient than the state statute
correct.
on issues such as this.
That's correct.
So before people start sending us 500 emails
Yes,
saying,
sir. Yes, sir.
amend our city code so that it contradicts the plain language in the state
Thank you.
statute,
Thank
which
you.
I don't agree with. I think we've all beat that point to death, but I don't see any alternative if the statute is upheld by the circuit
And
court.
again, I
If it
apologize.
isn't, that's fine. I can live with that. I'm a lawyer. But in terms of the perception that 3 of the 5 of us or all 5 of us can wave our magic legislative wands and somehow change the state law or change the outcome of this case to provide a remedy or an outcome that the state law does not provide, I don't see it. I'd like to, and I've spent way more time than I think most of the advocates on Cooper's behalf have spent analyzing this issue from a legal standpoint. And unfortunately, I don't see it. I wish there was one there. If the court wants to act, fine. If it's remanded and the hearing officer wants to change their mind on the evidence presented, fine. But I don't see that happening, and I don't see the remedy that the advocates are pushing for as being an alternative without a change in the state statute. So.
Just one last thing, since you mentioned the hearing officer, another thing and understanding the mayor's respect, that we get everything out there that is, that avoid misinformation. The hearing officer is an independent person, and I don't want to at all imply that we would have anything to say in how that person does her job. We can't tell her what decision to make. Doing so would be unethical and possibly illegal. So we would certainly not have, if it did get remanded, I'm not saying that we would have anything to do with, she will hear, if it's remanded, she'll, or our hearing officer will have another hearing and do whatever she decides is right in that hearing, and we will support what her findings are.
Okay,
Thank you very much.
thank you. Do you have anything else on comments?
No, I'm hearing the saw behind me on the gangplank already. I think I'll stop.
Okay. Discussion by city manager.
Yes, I'm going to try to turn this into a more positive. I always like to brag about when we get statewide or national recognition, and our water boys through Top Ops competition at the national level this year came in second. They won the state championship, and therefore they got a ride to national, and lost by 2 points. So they last year were national champions, but still it's quite a feat, their record and how many national championships they have. And why that's important to the community is because what this does is shows that our staff, who is producing drinking water, has a high level of knowledge as to what it takes to produce good drinking water. And that is not as easy as it sounds, because every time you pump water out of the ground, there's something different coming out of that ground a little bit, and it takes people who really know how to treat the water and maintain a system so that it is safe drinking water. So it's, I think, very, very positive. The other thing this time of year, some of you probably have noticed, is it's our internship program is in full blown speed. We have, I think, about a dozen interns this year. It's been an extremely successful program. Each one of them has a project that they're supposed to complete during the year. So it's the departments have to put together a work program, and so that they actually add value. They have a deliverable. Some of them have multiple tasks. And what this is doing is bringing back those young people into our community. Oftentimes, because many of them have graduated from FPC and Matanzas. Some of them not, but this gives them an opportunity to learn more about local government and hopefully can be more of an advocate for what we do in this business. And at the state level or regional level, we recently were asked to put on a program. We did that here on our internship program and had some of my colleagues there learn more about it. And one of them has actually invited us, Green Cove Springs, city manager asked us to present the program to their city council. And so Bo and I and Maeve is the intern that put the program together, are headed there tonight for their council meeting to talk a little bit about our program, and they're thinking about doing the same thing. So I thought that was extremely positive. One other couple of events here. Well, one specifically tonight, the very popular Food Truck Tuesday starts tonight at 5. I understand there's not supposed to be any rain, so hopefully people come out and enjoy that. And then I would just like to do full circle at the beginning, talking about Parks and Recreation, and July being Parks and Recreation Month. A lot of activities, a lot of opportunities out there right now for kids, from swimming pools to playgrounds, summer camp and the like, all the way to seniors. We have a lot of activities for seniors at the community center, and of course other games such as pickleball and golf and tennis and the like. So it's all part of that healthy community and promoting that, and I think our Parks and Recreation is doing a great job in that. Lastly, it is summertime, and so 4th of July is around the corner. Your next business meeting would be July 3rd, and we have canceled that because that's our celebration night, which means also the June 26th workshop has been canceled. So you get the next couple of weeks off, and then the next workshop will be July 10th, and back to regular schedule at that point. Mayor, that's all I have.
Move we adjourn.